Curtin Radio.
Well, I was just chatting to my guests who joined me in the studio about the reality of us all getting a bit older and hoping that all aged care services are well and truly in place by the time we get put in there, because over the years we've heard so many different stories, good and bad, and you know, you can't help but wonder, I suppose, whether things have got a little bit sticky or maybe just talked about a wee bit more since the COVID lockdowns and that sort of thing and the hospitals being stressed. But joining me right now, Sarah and Kenan Broad from Nurse Next Door Home Care Services. One of the G'day, guys.
Thanks for having us.
Thank you. Oh, it's great to meet you. You're so young. You might be around when I need to go. So would you mind doing a reference for us? I'm not that bad. I swear in my car I'm bad. I think I get overtaken by something that makes me swear a lot, but I wouldn't if someone was looking after me. I promise you. This is it is a very debatable thing at the moment, and I think perhaps these things are talked about more, don't you, Sarah? What do you reckon?
Yeah, absolutely. I think the reality for all of us is that not only are we all going to get old one day, but we all know someone who might be ageing, whether it's family, friends, loved ones. So the reality is we do need to talk about it.
Well, what comes with ageing, of course, Kenan, is normally you get something. You get ill health. You get weaker. It could be mental, it could be physical, it could be both. And getting the right care, the family members that watch their parent or auntie or uncle or whoever they know that's elderly, not getting the right care is terrifying to everybody. So what is your background?
I've worked in the public service for 15 to 20 years. I think part of the reason we got involved with this was, I see the connection between my work and the benefits we have, but I think I just wanted to be closer involved with actually seeing the results of the...
Well, obviously you've both seen in the areas, and you're a nurse, aren't you, Sarah?
Yeah, yep. So I've been nursing for over 22 years now.
Long time. Good and bad?
Yeah, absolutely.
Physically and mentally a bit draining sometimes?
Absolutely.
Yeah, it's coming through strongly. The whole thing is you must have seen a gap somewhere. Why do we have this gap? Why aren't we certain about where our loved ones should be going?
Well, I think more and more the demands placed on the healthcare system are growing. And, I think the COVID-19 pandemic has definitely, highlighted those gaps.
So it's always been there, hasn't it?
Yeah, I think so. I think that, perhaps the workforce might have been a bit stronger. We may have had a few more options. But now with a fading workforce or the challenge in recruiting and retaining staff, those gaps are becoming more evident, and so the gaps in the healthcare system mean that the flow-on effect, so is occurring.
It was always going to be happening, but the COVID situation has accelerated this concern.
Yeah, I think so, absolutely.
Well, of course, the staff shortages are very obvious everywhere, let alone nursing, the most important area, definitely for people. Okay, what do we look at? Let's look at the comparison. Okay, let's look at aged care. There's a bit of an inquiry going on, is there not? What are the concerns?
I think that the inquiries that have gone through the aged care system have been varied, from staffing to skills, to quality.
Yeah.
But, I think one of the other issues that we have is that, often people aren't aware of the options for their loved ones. So traditionally, when we think about getting old, we think about having to go into a aged care facility, and for a long time that was the only option available. And we've all heard those stories, mostly
there's been some bad ones,
mostly horror stories. But as time's gone on, there are more options now for people, and one of those options is to stay at home and have that care delivered in the comfort of your own home.
You're absolutely right. We are more aware that is available. Okay, there's a few things that obviously families have to consider, whether the elderly person can afford that. Are the government supporting them a little bit now?
Look, I think, again, the support from the government, although there is some support and some packages available, I think that's still definitely a gap, and definitely sometimes a prohibitive factor in terms of accessing that care.
I mean, it certainly has. I mean, there's not a lot of elderly people that have got huge superannuation funds, if they're at that age that wasn't compulsory until the 70s or whatever. So that is a very big consideration. I guess with staff, the carers that go into the home, because so many people can have so many different issues, can't they?
Yeah,
mental,
absolutely.
With dementia, Alzheimer's and physical, walking, just even the strength in their legs, whatever. So you're going to have specialised carers, aren't you, Kenan?
Yeah, one of the things we try and do is match our carers to the clients we have for a needs base. We hire on a culture first basis, and we match people specifically with specific clients.
Oh, so culture match up. So there is there's that link there. Yeah, something in common to start with. So language, that's a very good point, actually.
And one of the things that we do, which is a little bit different to other home care providers, is, we ask, our clients, what are the things that you used to love doing that you no longer can do? So tell us a bit more about yourself. Tell us a bit more.
Do you interview the clients?
Yeah, we do.
Okay.
So we actually, for all our clients that we get referrals for, we offer a complimentary 90-minute caring consult. So it's free of charge. There's no obligation. We go out to the home. We meet with the client and potentially their loved ones, and we talk through all those, care requirements.
Yeah. Well, of course, everyone has different interests in their life, and of course, physicality can obviously intervene sometimes. But, it's even just getting in the car and going for a coffee with your client.
Yep.
Or if they're capable of taking them for a walk and including them in normal day-to-day things. Now, that's a very good thing. We've got a caller. Is that okay?
Yeah.
Okay. All right. Philomena, good afternoon.
Yeah. Hi, Jen. How are you?
Good. Thank you.
Good. Obviously, it's something that's just hit home to us because my husband and I are both in our 70s.
Yep.
And I was going to say that it's the Australian government, which is the federal government. Basically, I got in touch with them. If you ring 1800 200 422 and discuss, what your needs are, and they automatically get in touch, give you the number to the office here in Perth.
Oh, okay. It's a government number, is it?
Yes.
And what do they provide, Philomena?
Well, it's called a home support assessment. You've got to be assessed first by them, right?
Okay. Yep.
Yeah. So they basically put you in the picture and provide you with all the information you need.
Okay. Do you know about this?
Yeah. So that would be the ACAT assessment.
Sorry.
Yeah. So that would be the first step in someone.
Everyone needs to do that.
Yeah. Okay.
Have you already done that, Philomena?
Yes.
And was it?
I just thought I'd ring up and let you know it's myaged.gov.au/view your My Aged Care online account. But basically just ring that number, which is obviously Sarah just knows the number.
1800 200 422. I've written that down. Look, thank you for that. And how did you feel how did you feel being assessed? Was it quite easy?
Very good.
Oh, that's
very easy.
excellent.
I basically came across the number in my doctor's surgery, GP, and I just took that pamphlet. I said, now this is something you've got to look at, right?
Okay, good.
And lo and behold, that's where it went from.
So, as a result, have you got results back yet?
Yes, you ring the 1800 number. They then give you the number to ring here.
Yeah, I know, but what I'm asking is, have you got the information back from your test?
Yes. I've had somebody come out and assess us and just tell us, give us all the necessary papers.
Okay, good.
So, yes.
Well, are you going to have home care?
Well, it just depends on your personal. They've got to come out and have a look at
That's what I was
survey your house and your property and stuff like that. So like you just said, from now on, they want people, if they can, stay at home and you get all the necessary help.
Sounds we're going in the right direction. Thank you for bringing through. We appreciate it.
You're welcome.
Thank you indeed. There you go. Tell us more. Sarah?
I guess what Philomena was talking about was having the aged care assessment. So currently at the moment, someone would come out to the home. There's 4 levels of packages that you can qualify for. So level 4 would be the highest package. And basically that's determined on, what your needs are, and then income,
Okay. And are people then assessed as to what the government may subsidise for home care?
Yes. So it is not as straightforward as just receiving the package. You also then have to wait until the package is available.
Oh, okay. There's a waiting list.
Yes. So
you do that with a smirk on your face, Sarah,
because that's
where frustration.
That's where the time lapse can occur. So currently in WA, the wait for the assessment is actually reasonably quick comparatively to places like Melbourne. However, the wait then to access the package can be anywhere from 6 to 12 months currently.
Well, now if you have got to the point where you haven't thought about getting assessed, and say you're 70s, right, and you're physically okay, mentally okay, can you actually get a test then?
Yeah, so you can have an assessment, and you might come back as a level 1. I think that it's much better to be looking at these things sooner rather than later.
Yeah, but I'm wondering whether they would consider you to be someone that would qualify because you're not physically in need at that time.
If you had zero needs, you were totally independent, needed no support. At that time. Then, absolutely.
But you have to wait to have something wrong with you.
Yeah, well, this is the problem. We're a reactive system still. We're not proactive.
No. Well, this is the very strong point that the government should look at. Prevention of people having to go into aged care or stay in hospitals. Yeah. That'd be the argument, wouldn't it?
Absolutely.
So is that being discussed?
Well, that's definitely a message we're trying to get out there, and we're trying to talk to hospitals, we're trying to talk to rehab facilities, we're trying to, merge into the aged care areas to discuss with them what the options are, not just about the service we provide, but generally, thinking about people going home before just transferring them into residential aged care facilities.
Okay, Ken, this is exactly what you were saying earlier, is that a lot of them in hospital are being attended to because they're unwell. To make room for someone else to come into the hospital, they need the bed, they put them straight into aged care. Okay, and that's obviously not suitable. I mean, there's obviously some good aged care places out there.
Yeah, no, and it certainly has its place. I don't think you can ever say that home care or residential care, one is better than other. Every person has a different need.
Yeah, that's right.
I think what we need to consider is that, there are more options for home care these days.
Can I ask you what home care actually provides?
Well, various different things, from personal care, domestic,
showering?
Showering, domestic support, help around the home, outings, social connections, accessing the community, meal preparation.
Oh, okay.
It might be that people need, shopping, getting to appointments. They need someone to go with them because they might have risk factors.
We're talking risk factors, what about fitting out the home with railings and ramps and things like that if it's necessary?
Yeah, and so that absolutely forms part of that aged care assessment. So when someone goes out there to do that assessment, they're looking at all those, does the home need modifications? Is it actually safe for that person to be at home and then access that care?
What comes with being at home if you're, disabled to a point in old age? There's a risk of isolation. Now, we've talked about this on many occasions with different people. Even if you're not old, if you're isolated, it's horrible mentally. So what if they don't have family or anything? The carer would become really important, Kenan.
Yeah, and I think that's one of the reasons that when we go out, we assess things like things that people used to love doing that they can no longer do, allowing them to go out and form those social connections with carers attending with them, just to avoid that, help solve some of that issue of the isolation people may face.
Yeah, it's really very important, that mental health situation too. And like you were saying, and I'm just repeating this, the carers, would have to know how to meet those special needs of every individual client.
Yeah. And our carers, particularly in our organisation, they have to have a minimum of a Certificate 3 in aged care individual support. So that is always the baseline that they've done. They've done some training.
They're special people, like all nurses. They really are. There's no two ways about it. Good afternoon, Judy.
Oh, hi. I just want to know, we've been assessed and we've got our level 2.
Oh, sorry, the phone's breaking up. The phone's breaking up. Oh, goodness.
Sorry.
This is very frustrating. Sorry, go ahead. Just bang the phone on the bench and we'll see what happens.
Okay. I was just trying to work our way through. We've been assessed and approved, and I'm trying to work my way through finding somebody to provide our aged care.
Yeah. How do you choose? Is that what you're getting at?
Yeah, how do you choose?
Yeah, that's a big thing. Actually, I'll get Sarah to do this without being biased, okay?
Okay.
Go on.
Well, I think for starters that you have to, find a service or a provider that, you connect with in terms of their values. What do they have to offer?
What do you do? Interview them? What do you do?
Yeah, well, as I said, we offer our complimentary caring consult.
That's right.
So that's it's an obligation-free opportunity for you to meet for you to meet us,
or any other provider,
and for us to meet you and to go through what your care requirements are. Particularly what I would suggest to you is to always make sure that whoever is going to come and do that caregiving, that they're qualified, that they're insured, and that they're the right fit. Sometimes just personality-wise, someone might just not be the right fit.
That's fair. And, of course, if you find the first person is terrific, should she interview other people or get other people to come and see her? Can't be biased, okay?
Well, I think, again, the other consideration, particularly with home care packages, is that, obviously at the front of people's mind is, they want their funds to go as far as possible.
Yeah.
And so whilst that's really important, and I think you need to ensure that you're getting value for money, I also think sometimes, cheaper is not always better.
Like in everything.
Yeah.
Shop around and ask around. I guess, there's something on the internet that you can possibly look at a whole list of home carers and that sort of thing.
So if you go to the My Aged Care website, you definitely can find a list of providers. Otherwise, your next step is get on Google, home care providers, ring them, talk to them, ask them what they provide, and,
look at the comparisons.
Yep.
Yeah. There you go, Jude.
Terrific. Thank you so much. Have a great day.
Thank you very much. There's a lot of people in that same position. Look, that was very interesting. And like I said, if you wouldn't mind just getting it right ready for me when I get there.
Absolutely. Okay. You've got our number, Jenny.
Yes, I've got your number. Well, it's a sad reality. And like I said earlier, I mean, when we were younger, we looked at people that were very elderly and said, they've had their life. Not in a mean, horrible way, but you didn't relate. You thought that, they're not making sense what they're talking about, the good old days and that sort of stuff. So this is the reality, isn't it? And you do need, when it comes that time, either a dear friend, if you haven't got a family, or a family member that really sticks by you.
Well, I think the reality is families are busy these days. So they're really busy, whether they're working, they've got their own families, and there's definitely some, confliction for people. They really want to be there to provide the support and help.
If you have a person that's got a regular GP and they are, in fact, showing signs to the GP that there is an impending illness mentally or physically, if that doctor were to write that information and they went and had that assessment, would that help them? If they're not showing it completely, is what I'm getting at.
Yeah, definitely. I think it's always worth to have the assessment, and we're definitely part of what we're doing currently is going around to all the GP clinics, and we're also educating them. Excellent. So we're letting them know that there are other options as well.
I feel like an expert now.
You are.
We're going to take a break. Ruth, don't go away. Back shortly.
Curtin Radio.
And we're talking the choices that people have these days, aged care or home care, and we have a caller for our guests in the studio. Good afternoon to you, Ruth.
Hi, Jenny. I just wanted to ask a question of... I'm sorry I didn't get the name.
It's okay. Sarah and Kenan.
Sarah and Kenan. If somebody has been assessed and they're on a level 3, but they need equipment or incontinence pads or anything like that, does that money for the equipment or the pads come from the money that is the level 3? How does that work?
Allowance, yeah.
That's actually that is a very good question that I'm not 100% sure of. I'm fairly certain that the continence products form part of that. The home modifications I'm not 100% clear on, because we obviously don't do these assessments ourselves. But definitely I know that if there were modifications that are required in the home, it forms part of the assessment. So definitely a question for the person who's done your assessment.
Yeah, definitely.
Okay.
Yeah, good point, because the costs can add up, can't they, Ruth?
Well, that's right. I actually do a service for an elderly lady that has incontinence pads, and I used to order them through a certain organisation, and it seemed to be a little cheaper than getting it through the service provider that we are at the moment. And I just wondered whether that then comes out of the money that's allocated to her.
Yeah, so if the service provider is providing those continence products, then they would certainly, I'm sure, be billing that as part of the service.
Okay.
Right, okay, rightio.
You're doing a great job, Ruth. Good on you.
Thank you. Yeah, no, she's a friend for 20 years. So
that's lovely. That is lovely. Thank you very much for calling. Yeah, see, you've got a friend doing it.
Yep.
And doing all these jobs that these people, to retain their dignity, have had to give over to somebody else. You know, that's the other part of it, isn't it? The dignity.
Yeah, absolutely. Yeah. And, often all people want is, I guess, to retain that dignity and to, be able to share their experiences with people. Often, clients are looking forward to the carer coming. They can't wait to sit down and have a cup of tea and have a chat.
That's true.
And I think there's lots to be learnt from our older Australians.
Can I ask you what feedback you get from the carers, Kenan, yourselves? I mean, when they are having to be so responsible, and they have to be very responsible, do they feel worthwhile? They must feel worthwhile.
Yeah, I think part of what we want our carers to feel is that, caring can be a career. So you can, look after people and feel valued in the what you're providing to society and to the individuals, that you're making someone's life better.
Oh, and they are. Can I just say, though, this sounds a wee bit negative, but sometimes, and I know somebody that was a carer for a long time, she found that the dealing with the family of the client... Oh, see, I've triggered you, so haven't I? That can be pretty tough. Is there any sort of mediation at all sometimes?
No, it can be an interesting dynamic, carers and families, but I really think that's part of our process, where we go out and meet with the clients and their families, and we
do they meet the carers before they employ a caring?
Yeah, so what we do is every time we send a new carer out to that client, they will be accompanied by our care designer, someone that they've met before, so that they can introduce them to that client and they can show them how things like to be done or what needs to be done.
And you can tell whether you're going to get on with somebody. You really do, because you've got that person in your home all the time.
Yeah, absolutely.
And do they go you're talking 24 hours here or what?
Sometimes. So some people require that 24/7 care. Other times it's, always, what we say is our gold standard is that, 3 visits a week for 3 hours. And that
each time.
Yep, and gives a really good opportunity for that carer to develop that relationship with the client and help the client to achieve the goals.
What happens when the carer's not there, if they got into some form of trouble physically, whatever, they fell out of bed or whatever? What are they? They've got the little alarm on their wrist or something?
Some clients personally have those safety things in place, but we also, when we do our assessment, we have, I guess, our own emergency response plan, and so they're also aware of the numbers that they can call.
We've got another quick call because I've got to go to the news shortly. Good afternoon, Denise. Denise, hello.
Good afternoon.
Yeah, Dennis, is it?
Hello.
Yes, we can hear you. Go ahead.
My name is Peter.
Oh, yes,
I'm
Peter.
52 years old.
Okay. Hang on, I'll just put you back to Patrick. Just a moment. Okay, that was the wrong call, I do believe. Where's Denise? I've lost her. Where is she, Patrick? What number is she on? Let me have a try. There we go. Have a try that. Is that you, Denise?
It is, yeah.
Gotcha. Go ahead.
Okay, I was listening with interest to the lady who just rang in about the level 3 allowance.
Yeah.
Whether you could get equipment.
Yeah.
I'm actually on level 3, and that is my only need at the moment. And I have got several pieces of equipment, including one of the beds that adjust to your sleeping position. So I just wanted to say, yes, you can get equipment.
Well, that is great. I'm glad you called through, Denise. Thank you very much.
No worries. Thank you. Thank you for the segment. It's very interesting.
Yeah, thank you. Yeah, there you go. So you can tell people with authority now. You know that. We haven't got time to speak to Peter. Patrick, I'm sorry. We've got to go. Thank you, guys, very much indeed for coming in. Much appreciated. Actually, if you put the question on the screen, I might be able to squeeze it in. I'll get him to type it, okay? All right, so the thing is, people have to go through a process. It can be quite lengthy. Right? And if you start to get diagnosed with ongoing dementia or Alzheimer's or physically you're getting worse, then of course you have to start looking to go into the process. Okay, what I'm going to do is I'm going to get Patrick. You can take a call outside, do you mind? You see all the sign language that goes on in here? It's called shorthand. Oh my gosh. Thank you so much. That was really interesting for so many people. Sarah and Kenan Broad, Nurse Next Door Home Care Services WA, and the government number 1800 200 422.
Curtin Radio.